Good afternoon, and welcome to Like a Boss One-on-One Live. Today, Portland Press Herald publisher and CEO of Masthead Maine, Lisa DeSisto, will be speaking with Jeff Brickman, President and CEO of Central Maine Healthcare. My name is Allison McCann, and I'm delighted to welcome you and thank you for joining us on this gorgeous Friday. Just a few announcements and thank yous before we get started. I would like to take a moment and thank our sponsors, many of whom have been supporting Like a Boss for years. They are Harvard Pilgrim Healthcare, Hub International, JP Morgan Chase, Vistage, Coffee by Design, and our very special presenting sponsor, Bernstein Shure. To say a few words, I'd like to introduce Joan Fortin, the CEO of Bernstein Shure. Joan?
Hello, everyone. Good afternoon. I hope everyone's having a really terrific day. I'm Joan Fortin, the CEO of Bernstein Shure, and it is my pleasure to welcome you here to this latest episode of Like a Boss. We're very proud to sponsor this event featuring Jeff Brickman, President and CEO of Central Maine Healthcare. The series continues to provide a vital glimpse into the everyday realities of leadership in Maine's businesses. And I can't think of an industry that's more top of mind for all of us right now than the healthcare industry. At Bernstein Shure, the health and safety of our people is paramount, both because it's our core values and because it's critical to our success. And I know that's true too for all of you who are listening. So with that in mind, I'm really excited to hear what it's been like, not only to lead an organization through the ongoing pandemic, but to lead an organization that's really been on the front line of keeping us all safe and getting us through this pandemic. So I'm excited to hear about Jeff, but before I turn the floor back over, I just want to say thank you to Lisa DeSisto and the Portland Press Herald for bringing us together time and again to have these really exciting leadership discussions. So thank you, and over to you, Lisa.
Well, actually, thank you so much, Joan, and we're so appreciative of the partnership that we have with Bernstein Shure. And now, without further delay, please enjoy Like a Boss.
At Central Maine Healthcare, we aim to provide high-quality, affordable, and convenient care to Maine people where they live, work, play, and pray. We serve 400,000 people in Central, Western, and Mid-Coast Maine. Our network includes Central Maine Medical Center in Lewiston, Bridgeton and Rumford Hospitals, the Central Maine Heart and Vascular Institute, the Topsom Care Center, Maine Urgent Care in Lewiston and Topsom, and next year, a state-of-the-art cancer care center. Our roots stretch back more than a century, but we are focused on the future. We leverage technology improvements and relocate some services outside hospitals to increase convenience and reduce costs for both patients and the healthcare system. Our mission is to deliver exceptional care through the expertise, commitment, and compassion of our team. That is how Central Maine Healthcare is leading the way and changing the face of healthcare in Maine.
Well, thank you, Joan and Allison, and welcome everyone to Like a Boss. And I would like to welcome my guest, Jeff Brickman, President and CEO of Central Maine Healthcare. Hello, Jeff.
Hi, Lisa. Thanks for having me today.
We're so happy to have you join us. Now, you recently announced your retirement last month, so I'm expecting a very candid conversation. Are you ready?
You know, I'm as ready as I could ever be.
Great. So we saw in the video an overview of the Central Maine Healthcare system, but why don't we hear a little bit more from you?
Sure. Central Maine is a comprehensive health system serving a number of communities. We serve Central and Western Maine, extending into the Mid-Coast. We're an organization well over 100 years and going strong. We're an organization that is the third largest health system in the state of Maine and have done a lot to really grow in a number of different ways over the last 5 years, particularly trying to reshape how healthcare is delivered in a very affordable and accessible and high quality manner. We have about 3,500 of our team members who work across those particular parts of the state. We see roughly 60,000 admissions, almost 500,000 outpatient visits a year, roughly 520 to 540 million in net revenue. So a pretty substantial healthcare enterprise with a very large and important impact on many of the local communities. We find ourselves typically the largest employer in all of our communities. And not only do we provide for the health care needs, but we also are a major engine for the local economies in many of the communities in which we're situated.
Yeah,
and we're very, very proud, very proud of our ability, particularly during this last year, to really help our communities through probably some of the most daunting public health challenges we've seen in our country's history.
Absolutely. Well, speaking of that, we have seen the number of cases spike, specifically in Androscoggin County, where you're headquartered. What do you think is driving that, and how's the system coping with it?
You know, I wish I could answer that question. We've seen the different cycles of coronavirus in the state as it's moved through different parts, beginning in Cumberland County, moving through Androscoggin to Oxford and Sagadahoc. It's interesting. We all seem to have had our moment in the sun, if you will, in which individual parts of the state have experienced different levels of peak activity at different periods of time. We have been in our key communities probably the last community to really see this level of peak activity. And it's interesting because our team of healthcare professionals, first as CEOs and then as a group of clinical leaders, have been coordinating our care, coordinating our approach, integrated standard approaches to treatment and prevention in a very consistent manner, assisted with a number of the state's public health officials. So we're all doing the same thing. Local differences in community adoption of public health practices seems to be the only variable that we can put our finger on, but we're all approaching this in a very standard and coordinated manner.
Mm-hmm. Now, let me jump right to a question from Nancy Marshall, because it's obviously connected to the number of cases. What's your opinion about requiring employees to get vaccinated? Because that seems to be just critical to getting through this.
You know, there is a growing body nationally as we take a look at our obligations to provide a safe and protective environment for our own staff as well as our community members. It wasn't too long ago where we adopted as an industry mandatory flu vaccinations. And right now, about 15 months into this pandemic, our industry is just beginning to raise that as a question for us to embrace, because we believe ultimately this type of treatment is going to be with us for many years to come. We believe that COVID will probably be a chronic disease, much as flu is. And ultimately, we're going to have to move to a position where we're going to require the same level of vaccinations. But at this point in time, we're really trying to approach it through education. We're really trying to approach it through peer pressure. And we're really trying to do our best to get people to understand the science and to adopt that. But ultimately, I think the industry will start to move in the way that we have with other vaccinations and other requirements to provide that safe, protective environment.
And I know that you're working to encourage your employees to get vaccinated, but it seems to be right in line with their passion and why they got into healthcare in the first place.
Well, yeah, you know, our staff are in healthcare to provide care to help other people. Our staff, unlike other members of our community, wake up every day going to work, understanding that some of the conditions that they face are ones in which other community members don't want to come close to. Our staff members show heroism every single day. And even under the most uncertain and daunting conditions, you know, we're amazed that they show up and they walk in willingly into this environment because they value assisting and helping other members of the community, irrespective of whether it's COVID or SARS or HIV. And we can go back over the years and decades that I've been in healthcare, and there's always been a public health challenge of one kind or another. And yet our staff and our industry has always risen up to the challenge because that's in our DNA. And that's what makes us different. And quite frankly, I think that's what makes our community so dependent and so appreciative of what we're able to do on their behalf.
For sure. All right, let's go back a few years. Now, one of the things that we discovered in our sort of pre-talk was that we actually grew up about 5 miles away from each other. So what was
Yes,
it
we
like
did.
growing up in Malden, Massachusetts?
Well, Malden, Massachusetts, as you and I know, is a suburb of the greater Boston area. And in the times that you and I grew up, it was a very different world. In Malden, it was a very working class community, many of which used it as a bedroom community for a lot of the businesses in Boston or right in the surrounding suburbs. And for me, it was a little unique because not only did I grow up with a strong work ethic, but I was fortunate at a very early age to grow up surrounded by members of the healthcare community. My grandfather, my dad, my uncle, my grandmother, and ultimately I even married a nurse with my wife, Elaine. And my earliest memories back in those days was doing house calls with my grandfather as we went through the greater Boston community, taking care of first generation immigrants who had come in from different parts of the world, mostly from Eastern Europe, in which my grandfather would take me, usually on a Saturday or Sunday morning or afternoon, visit the patients, go back to his home in Malden, where his first floor was an office, where his wife, my grandmother, and he would tend to patients. We would work during those days. I was trying to stay out of the line of fire. And at the end of the day, on that weekend day, we'd go up to the living quarters and we'd relax and have lunch or dinner or something like that. But what I learned in the greater Boston area was the value of hard work. It was exciting to be around a very vibrant community like that. And as I went on to the rest of my education and learning across the country, I always kept the core values of New England with me. So when I had a chance to come back to Maine, it felt like home.
Mm. And now you made the decision to go into hospital administration and not direct care. So how did that come about?
Well, I always tell the story, second semester organic chemistry did me in. There was something about the three-dimensional boat models that we had to do are called stereochemistry that just was beyond my ability to do well in that. And I went home, I remember at the end of that semester, and I sat down with my grandfather saying, I just don't know if I can do this part of the work. He said, look, you've always been a leader in everything that you've done, from academics to sports to community activities, and you love healthcare. Have you ever thought about going into healthcare leadership? And I said, I hadn't heard anything about that. And he introduced me to a couple of community leaders in our hometown community hospital. They gave me a sense of what the possibilities were. And before you knew it, I had changed majors. I went on, received my MBA in healthcare, and I was able to click at that moment. And 41 years later, I'm in a position where I'm looking back over a very lengthy career, all related to organic chemistry and my grandfather's good advice.
That's great. So after grad school, you're ready to embark on your career and you start at Baystate Health Systems in Western Mass. So why don't you walk us through, I mean, I'm not trying to, minimize that, all your different stops, but until you got to Maine.
Well, when I came to Baystate in Springfield, Massachusetts, it was my first real job after I had finished my residency in Philadelphia, where I also went and received my MBA from Temple University. And my first job was as the assistant to the chief exec. And that chief exec had just taken his first job after coming up from Hartford Hospital in Hartford, Connecticut. And my first 2 years, as he put together a new team and a new strategy, I did the research, I did the writing, I did all the key staff work. And we were facing towards the end of my second year, a national accreditation review. And I had spotted the need to do some things differently. And as a result, the survey was done. The opportunity came in for me to fill in for a key position. And before I knew it, I was a leader in a role taking over for a physician executive, really helping the organization pick up on some of the recommendations. And 17 and a half years later, I was running the flagship for that health system, all based on being in the right place at the right time, being able to solve problems that other folks were not able to solve, being able to help an organization achieve at a different level, and create my own track record of helping organizations really achieve their highest potential.
Wow, that's quite a hands-on experience from your first role there or first day there, and then to stay for 17 years. And then you went to Meridian Health Systems, is that right? And where's that based?
Yes. Meridian Health was located in Monmouth and Ocean counties, the central part of the state, just outside of New York City. And I went there to be the chief operating officer of their health system and president of their hospital corporation. And again, I was faced with an organization needing some help to be able to improve operations. I had to literally close a hospital within 4 months of arriving in New Jersey, consolidating that into one of our other hospitals, reversing very significant losses that had preceded my arrival, and within 12 months, turn that organization around where we were back into a positive position, had strengthened our foundation, and then over the next 5 years, really build up in each of our communities from Brick, New Jersey, to Neptune, New Jersey, to Red Bank, New Jersey, and many places along that path between Ocean and Monmouth County, a very extensive set of programs that ultimately grew and grew. And by the time I had left that organization, we were significantly stronger, and it had provided me an opportunity to join another health system in an even a larger role.
That's quite a turnaround, though, to have to close a hospital so quick after you got there, and then to turn things around in 12 months is really remarkable.
Yes, it's not something that I would recommend for the faint of heart. It's
Right.
not something that they teach you in graduate school, but in our industry, with how things keep moving, it was a valuable experience and really taught me a lot of lessons that I further incorporated further into my career.
Mm-hmm. So you had 2 more stops then before you got to Maine.
Yes. After I left Meridian Health, I went to Provena Health in the Chicago suburbs. I led a number of hospitals there. I did significant work in quality improvement, strategic repositioning of a number of our programs to help that very large health system position itself within a very crowded Chicago market. I was with that organization for 7.5 years. Did a lot of program building, a lot of new hospital construction work. We did quite a bit of work to improve our quality and our standing against some very large academic medical centers and larger health systems. And then I was able to translate that into even more significant opportunity in Denver, Colorado, where I joined a 17 hospital health system called Centura Health. I've helped lead the largest segment of that health system and helped double the growth of the group of organizations that I led over that 5-year period of time. Did a lot of work in terms of quality improvement, service improvement, changing the delivery model to move from a hospital-centric model to one that was more ambulatory or outpatient, really finding a way to reduce cost, provide care more locally. We like to say where people live, play, pray, and work. And we did that in a very significant way that allowed our organization to become quite successful in yet another very crowded and competitive set of communities that made up the metropolitan Denver area, all the way into the mountains, reaching into Vail and Avon and a number of other key resort areas across the mountain ranges, just an hour to an hour and a half north of downtown Denver. Some of the opportunities in that last environment was to really adapt a leadership style that has really helped in my entry here in Maine, and give me the opportunity to be prepared for the challenges that we found once we came here 5 years ago.
Mm-hmm. Now, your family must, were they saying like enough? I mean, you moved them around quite a bit, so you must have a very supportive network.
Well, that was a big change. Well, my wife Elaine and I have been married. In just a couple of weeks, it'll be 41 years. And she grew up in a very different environment than I did. Her dad was lucky to work in the same company and have very regular hours from 9 to 5 for over 40 years. And then she met me and started to find out about what healthcare leadership jobs were all about. Even though Elaine is and has been a nurse, she didn't have in her mind that she would have to make as many stops along the way as we have over 41 years of marriage. And in our industry, if you're interested in healthcare leadership positions, it's the rare individual who is able to start and end their career in one location.
Right.
It's a very, very competitive field. The opportunities don't come around that often. And more often than not, if you're looking to advance your profession, sometimes you have to be willing to move. And one of the saving graces in my professional career has been having the support of Elaine, who has been that secret sauce, if you will, because in every community that we have entered, Elaine has been that glue to the community through her volunteer efforts, through her ability to connect at a very ground roots level, her ability to translate the work that we're doing within our health system at the community level. And from someone who never did that before to one who's become very adaptive, I've been more than fortunate to have Elaine as my wife and my partner in 41 years of my career.
So two constants over the 41 years then, Elaine and your love for the Red Sox.
Well, I grew up in Malden. So as you know, growing up in Reading, Stoneham area, it was a short hop on the subway into Fenway. So I spent most of my free time roaming the center field bleachers and any grandstand and box seats I could sneak into for as many years as I can remember.
Yeah, very resourceful. All right, so you're back in New England. You come into Central Maine Healthcare, and it's in pretty tough shape when you arrive. You were brought in to turn things around, obviously, based on your history that you just reviewed from us, the transformation that you made at each stop along the way. So where do you get started?
Well, when I came in, the organization hadn't identified itself as being ready for a turnaround. That was part of our discovery early on. And once we came in and found the organization needed some assistance, within a matter of several months, we had diagnosed what we needed to do. And we had to make some very significant structural changes and program changes and leadership changes. It's not something that's easy. It's something that we don't do without a lot of thought and a lot of strategy. Because quite frankly, at the time of my career, I was looking forward to doing more strategic repositioning work. Yes, I had done a lot of turnaround work, performance improvement work, but I was also looking to do some other strategic work. we found an organization that needed some significant performance improvement. And we spent the next 2 years significantly improving the balance sheet of the organization, the leadership structure, some of the underlying systems. And then we had a pushback from some of the changes that we made. And that was hard to deal with. Change management, when you haven't had change in some time, is sometimes a natural reaction to significant structural change that's necessary to preserve a business, in this case, a set of healthcare organizations. And we had to weather that, and that pushed us back. And then we came through that in less than a year and really built back up. We had a little bit under a year and a half of very solid financial performance, rebuilt our balance sheet and our financial strength. And then guess what happens? We have a 100-year pandemic. And not only Central Maine, but every other organization in healthcare and every other business segment across the world and in our country and our state was significantly impacted. And now in May of 2021, as we're coming into our 15th, 16th month of COVID, we're climbing out and we're going back and we're rebuilding our strength, we're rebuilding our momentum. We've got a very strong set of strategies, a very strong leadership team, and we're beginning to put COVID in our rearview mirror. So you might say from the moment we came to the state, we've had a number of different type of challenges, but we've been able to come through it each and every time because we've had our focus on the needs of the community, the needs of our organization, and a firm belief that we had the right type of staff and resiliency to weather that storm and ultimately get to where we wanted to go.
One of the things I most enjoyed about our pre-conversation was hearing about your leadership principles and sort of the format that's done you right at every one of your stops. Do you want to talk about that?
Sure. I've been very fortunate in my career where I've had very strong mentors to learn from. I've been very fortunate to have worked with a number of people in the field of leadership and management, where I've become a real student. And a couple of basic principles I live by is leaders are responsible to provide the strategic direction for their organization. They're responsible to provide resources, to remove obstacles, and to develop other leaders. It's that simple. What's hard for many leaders is then to actually practice those principles day in and day out. And one of the fortunate approaches to leadership I learned early on was the value of bringing in professionals in organizational leadership to assist myself and my teams in being able to role model those principles. So with every organization that I have been associated with, I've used those outside leadership resources to help handpick leadership teams, to help teach leadership teams to work as a team, to be collaborative in their approach, to mentor and develop other leaders, and to role model a bottoms-up approach to leadership decision-making in a way to engage and fire up the enthusiasm and passion of the most important members of our organization, which are our individual team members, who through each of their individual contacts with our patients and family members, they're able to carry our message both inside and outside of our organization about what our mission is and what we're trying to do. And those basic principles are ones that I've written about, I've used as a way to help teach and coach others so that we can pass on our learnings to the next generation and to help other leaders understand those basic principles as well.
So really using that model, is that what helped inform your decision that you were ready for retirement because you've got a core team behind you ready to go, right?
Yes, I would not have made the decision to retire from institutional leadership without having a very strong team that we've been able to develop and mentor and put in place. That strong team allows me now to pursue other opportunities outside of being an institutional leader for an organization such as Central Maine Healthcare.
So change management is something that you've done time and time again in your career. And I know Strawberry is going to pop the link up in the chat of the piece that you wrote for the Harvard Business Review in 2016. And I would love to talk about that for a couple minutes. So the title is How to Get Healthcare Employees on Board with Change. So tell us some details about that lesson.
Well, as I wrote in the article, we were extremely successful in really advancing a lot of the work to change the delivery system of that local sub market or subsystem of Centura. We had a very large footprint. We did quite a bit of work. But as we got deeper and deeper into our success, we found that some of our success was not that well understood by our individual team members. And as we looked at the level of engagement, we weren't happy with what we were seeing and hearing. And so we went back to basics. I spent a significant amount of time rounding through our organizations at the early mornings. And my staff knows this, so I'll share with the viewership today. I don't sleep much, and I've been in a hurry since I was born. My mom says I was born 6 weeks premature, and I've been in a rush ever since. And as a result, it kind of affects my day-to-day routine. I wake up early, and I get up and I go. And when I was concerned about what I was seeing and hearing, I got up 3:30, 4 o'clock in the morning, began to round on our night shift throughout our organizations to find out what was missing. And what was missing was a sense of engagement and attachment to a lot of the approaches that we were taking. And so working with some of our executive resources, we created a set of teams built with frontline staff, approaching some of the key issues within our hospitals that we needed assistance in moving. We've taught our individual team members how to break down problems into bite-sized chunks and gave them the opportunity to use their own knowledge of the local hospitals to provide their thoughts and responses to bring solutions. We surrounded them with structure and individual decision-making tools, and they began to take charge. And they brought forward a number of recommendations. They helped bring solutions, and they actually help execute against those solutions. And at the end of that process, we found a significant leap in their engagement, their level of pride, and their level of attachment to what we were trying to get done. So we had our cake and ate it too, because not only were we successful with our strategic and our performance improvement and quality improvement activities, but we're also successful in firing up and engaging our staff so that they were able to have a sense of pride, a sense of responsibility, and a sense of impact that they brought to our success. And that had a significant impact on recruitment, on retention, and overall pride as an organization.
Yeah, I think that's a really
pretty simple stuff.
Yeah, well, no, I think it's a really important lesson. And I devoured the piece. And even though it's about getting healthcare employees engaged in change, it really applies to every single industry, right? It's about having your team create the strategy, and then therefore they buy into it because they own it.
Yes, I think leadership is similar across any industry. There is no particular secret sauce from one industry to another. Treating your staff and your customers with respect, giving them the opportunity to be part of the decision-making, giving them an opportunity to influence how your organization is being run is really the key to any leader's success.
True. However, the job of running a healthcare system, being a CEO of a healthcare system, is a little bit different than other roles, because it seems you actually have less control over some of the key parts.
Yes, well, if you've ever read any of the leadership texts, there is a known leader by the name of Peter Drucker. And Peter Drucker is known along with Warren Bennis and Peter Lencioni and Jim Collins as one of the thought leaders in modern day leadership theory. And in Peter Drucker's book of management, he described the role of healthcare leadership as the most complex field of leadership in our business world, because we don't have total control of our environment. If you think about it, our payments are provided by state and federal agencies for Medicare and Medicaid, largely set through public policy that we may or may not have total ability to control. And that usually makes up between 50 and 60% of our income or our revenue. And typically Medicare, Medicaid do not pay costs. So that puts the burden of healthcare payment on our commercial insurers to really pick up for what the state and federal levels don't provide fully in Medicare or Medicaid payments. Then on top of that, you're dealing with individual needs that may be related to lifestyle, to education, to income levels, to access to public health. And in an environment where healthcare leaders and healthcare organizations are being asked to take on risk to improve the health of local communities, you're asking doctors and nurses and healthcare organizations like hospitals and health systems to step in and to improve the health when many of those social determinants of health are ones that have existed for a long, long time. And all of a sudden, healthcare organizations are asked to take on that responsibility. We can't control all of that. Mm-hmm. We also have a number of other challenges that are unique in terms of our leadership. We deal probably more through influence than just line command and control, because in many parts of the country, some of the key leaders that we rely on, such as our medical staff, are individual business leaders in their own right. And they work by being associated with our organizations, but in many parts of the country outside of Maine, where they're not largely employed by health systems, they have many choices. So your ability to influence physician leaders is as much an art as it is a science. Yeah. And so our job is part leader, part politician, part communicator, part strategist, and part counselor. And it never leaves for a dull moment.
Yeah. Yeah. And I think the only other thing that is similar would be to lead an academic institution, perhaps, right? With the different constituents.
Absolutely.
But I still agree that healthcare is more complex than that, right?
I would agree.
Yeah, of course you would. So growing up outside of Boston, you and I both believe that the sun rose and set over Route 128, and anything outside the belt of 128 was irrelevant. But you had the opportunity to work in 7 different states and bring best practices from other parts of the country. So what would be a great example of something that wouldn't have been on our vision if we had stayed outside of Boston?
Well, it's interesting. You're right. Growing up within that 128 belt, you're taught at a very early age that Boston's the hub, and that it's the center of the academic universe of the world, and that the sun rises and sets in Boston and no one else is close. Well, having worked across the country, you find out that there's more than one way to solve problems. You find out that there's more than one way to provide healthcare. And one of the things that I have learned, particularly over 41 years, is that healthcare and its delivery is very different depending on which part of the country you live and work. And it affects healthcare status, it affects healthcare costs. And in the Midwest and in the Rocky Mountains where I've worked, I've probably seen more innovation in how healthcare is provided than I have seen in New England. And what I found that was very different is an adaptation of providing healthcare outside of a hospital four walls, providing it in ambulatory surgery centers, providing it in outpatient radiology centers, providing it in outpatient physician offices, providing it in many different ways that did not rely on the costly infrastructure of a hospital setting. And when I came back to Maine, I came back to a part of the country that had not matured in their approach to healthcare delivery as I found in those other parts of the country. I found a state very traditional in its approach and only beginning to adapt in a way that other parts of the country that I had seen had already adapted. And as a leader for Central Maine, we've been engaged in a dialogue with our communities, with our board, with the major businesses and payers of insurance to say there's another way in which we can provide care that will ensure a high level of quality, but to do so in a way that is closer to home, more accessible, and more affordable. And if there's one thing I've learned about the state of Maine is that that level of innovation is very much in demand and needed, probably more now than ever before.
Mhm. So, did you ever imagine that you would have to manage through a global pandemic? Like, was that something that was on your radar?
Never in 100 years
Right.
I believe that that was going to happen.
So
But
go ahead.
it's interesting. I was in New Jersey during 9/11, and I never expected to see what took place during 9/11. And many of the hospitals that I oversaw served as receiving areas for many of the walking wounded who left Manhattan. And I never expected to see that. I never expected to, live through and work through HIV or SARS. It's just part of what we see in healthcare. You never know what the day is going to bring. And one of the lessons I've learned over 41 years is that our healthcare industry and our staff are dramatically resilient and innovative and up to just about every challenge you can believe. So no, I didn't expect to deal with a 100-year pandemic, but I think that's part of what makes us unique as an industry and as a group of professionals. We're up to it.
From a planning perspective, do you think that there's anything that we should be taking forward to be better prepared? Or do we have 100 years to plan for the next one?
Well, it's interesting. I think the lessons that we have learned as a state is the importance of a public health infrastructure. I think the lessons we have learned as a state is for coordination of care delivery and planning for these type of events. I think the lessons we have learned as a country is to prepare for these type of eventualities and to have a plan that can address these type of issues now and in the future. If we read and listen to the experts from the Centers for Disease Control or the Institutes of Health, the challenges of other type of pandemics has been known for years. And I hope this serves as a wake-up call to really go back to our roots. I talk about doing house calls with my grandfather. I would say the analogy for public health is to go back to the grassroots for public health education and infrastructure, because these challenges are not one and done. They will reoccur if we listen to our experts. And I think we have to be mindful of them in our planning, both as organizations and both as state infrastructures, to be prepared for this, because it will occur again.
Mm. Yet through all of this, you actually managed to keep the top initiatives for the system moving forward, including the new cancer center.
One of the roles of a leader is to always lead with the strategic direction and goals in mind. So even though there are all sorts of things happening around you. The most important thing of a leader is to make sure you're providing safe, protective care. You're providing for the basic needs of your staff and your community, and you're also planning for the future. So yes, even while we're working through a pandemic, we were successful in groundbreaking on October 29th of last year for a new oncology institute. And as recently as Friday, May 7th, we had a topping off ceremony to put in the last steel girder to complete that strategic milestone of having that steel frame completely erected, and now begin to move on to putting in the outside skin on that facility, so that a year from now, or less, actually 10 months from now, we'll open up a state-of-the-art brand new oncology center to serve Central and Western Massachusetts. Central and Western Maine, yes. We've put in strong strategies to strengthen our orthopedic service line. Most recently, we went through our largest acquisition of a physician practice. Central Maine Orthopedics just joined our health system on March 1st, right in that pandemic. We've been able to successfully recruit new leadership for our Central Maine Heart and Vascular Institute. That leader will be coming on board in just a couple of months. We've been able to strengthen our level 2 trauma program. We've been able to strengthen our outreach in primary care. We continue to provide innovative approaches to affordable outpatient approaches to healthcare with our main urgent care, our partnership in outpatient imaging centers and outpatient laboratory services. We continue to innovate because we continue to need to differentiate ourselves within the state. We need to continue to do so to meet the needs of our main communities. We need to be true to our strategy of being a value-based health system that provides affordable, accessible healthcare at a high quality and in a manner that is service-oriented. All of that work has to continue, or we won't be successful.
Yeah, it's really remarkable that you've been able to move your strategy forward on schedule, on budget, while we're dealing with the biggest public health crisis in more than 100 years. So I congratulate you for that. And the cancer center really will be game changing for that region and that county, or those counties, for sure. So congrats on that. All right, I'm going to move to some questions that we got in advance. This is from Katie Tavares. I made her last name Tavares like the 70s disco band. I don't know if that's exactly right, but I decided to go with it. What do you see for aging seniors in Maine? Does the hospital have plans to work with other organizations? So that is a big issue facing Maine.
Yes. As we look at the state and we look at the aging of the population, we realize that the largest and fastest growing part of the state's population is in the 65 and older population. So we've looked at the diseases of aging, from cancer to heart disease, and we've strengthened our programs. We have placed our residents and our faculty and long-term care facilities to help improve programming that are specific to the needs of the aging. We have strengthened relationships in what is called the post-acute part of healthcare, which is home health, skilled nursing, or nursing home facilities, in which we are increasingly looking to those partners to be able to fill in care gaps of care for that population where particular programming may not be readily available within a traditional hospital setting. And then as we go further down in our planning, we're looking at geriatric programs of emphasis. So how do we take care of the elderly in an emergency department setting? How do we take care of the frail elderly in our primary care office settings? How do we provide access to good outpatient care for the chronic illnesses that are increasing in number as we age in place? How do we take advantage of useful applications like telemedicine to reach out and provide on-demand access to healthcare and counseling when someone is in need of it and they may not be able to come in on their own volition. So we're constantly looking at those needs for that community as we continue with our program planning.
Are you worried about labor shortages to help fill all of these positions, especially as you're trying to move things more to aging in place and helping people be at home?
The manpower supply in northern New England is an interesting challenge. In other parts of the country, we can talk about manpower shortages for nursing, which is reaching its highest level of shortfall. Although we think that some of the most recent economic downturn will begin to revitalize potential staff's interest in healthcare as a field of study and employment. In Maine, as I talk to other business leaders across the state, the one common issue that I hear all business leaders talking about, irrespective of industry or business, is access to a skilled workforce and how we find enough staff that will want to stay and work in Maine, and what we need to do. And our health system, like any other business in the state, is facing those type of challenges. So increasingly, we're looking to provide our own supply of staff. We're fortunate that we have the Maine College of Health Professions. We're increasing the size of its faculty and its importance for our organization. We're using that very strategic organization and institution to create the stopgap measures or strategies to create our own skilled workforce where we might not be able to find in other parts of the state. And then, of course, we have other strategic academic affiliations with all the main colleges and universities within the state. We're a teaching organization, so we take on a number of students and residents and fellows. And then when that fails us, we go internationally, and we've gone internationally to look for labor. We've gone across in other parts of the country where there's actually a glut of some healthcare occupations, and we bring them in and we set them up in temporary housing. We're trying every approach that we can think of, and yet we still have shortages, and we're trying to work through that as we look at technology and we look at redesigning our traditional work to find other ways in which we can provide care. And telemedicine is a good example of one such approach.
Mm-hmm. So with the stress that comes with the labor shortages, a question from Ellen Berlin from the Dana-Farber Cancer Institute. Looks like she's in Kennebunkport. Given your high level position, what do you do to manage stress?
Well, that's an easy one. My staff jokes about whether or not I've run in the morning or not because they can tell. And so as a lifelong runner, probably competitively from the age of 5 and youth and age-related track and field events to my age of 65, I run on the average of 5 to 6 days a week and have been doing it since I was 5 years old.
Wow.
So that is a great way for me to think about what I need to get my mind and spirit in shape for the challenges of the work. I also do other things. I throw heavy weights around when I've had that stressful point, and I can think evil thoughts and move large amounts of weight around and find that I take that stress right off of me. I'm known to watch trashy action movies and read bad books. And when that's not enough, I go out and I follow my beloved Red Sox, Celtics, Patriots, and University of Connecticut men and women's basketball. And when that's not enough, I go hide and go to somewhere along the Cape, and I just eat bad food and watch the waves come in and the sunset. And that's usually good enough to get me back in shape to be able to do the work and the challenges that I face every day.
Well, you've got a long list of things that you enjoy to manage your stress. We have a question from Peter Del Greco, and he asked the question that I already asked you. So Peter, I hope you feel that Jeff answered this about bringing best practices from across the country. I feel like you covered that. But here's a non-healthcare question.
And he's another Reading grad like we are, Lisa.
That's right. We all got our chicken pies at Harrow's. So a non-healthcare question. Now that Harry Sinden, the man who ran Bobby Orr out of town, is no longer with the team, will you cheer for the Bruins to beat the Capitals in the playoffs this year?
Oh my God, that's such a great question. Well, I actually, you may not know this, but my older son, Josh, is an executive with the Bruins.
Oh.
He's a strategy and business development vice president. And I had boycotted the Bruins since 1975 when they traded Phil Esposito and then subsequently traded Bobby Orr. So whoever wrote that knows my bias. But yeah, since they've gotten rid of all that evil level of executive leadership in the Bruins, I think along with my son's position in the Bruins, I can absolutely root for them this year.
Okay, we believe. A question from Christine Rendu. Walk us through how you take the ideals of delivering healthcare and align these with the challenges of running a healthcare business. That is a great question.
How can we take the ideals of, say that again, please?
Oh, what? I just lost it. Hold on. Got to open the right panel. Walk us through how you take the ideals of delivering healthcare and align these with the challenges of running a healthcare business.
Okay. Well, a lot of it relates to how we align our leaders and our staff and our community in a future state. So as we talk about the ideals of a healthcare system, it's getting everyone in our organization and outside in our communities to understand where we're trying to go. And that in healthcare, as in any other business, you have to adapt or you don't survive. And we could either be Blockbuster or we can be Netflix. We can be Kodak or we can be something else. We can
Instagram.
We can adapt or yes. We have to constantly change. And in over 4 decades of healthcare leadership, if there's one constant in healthcare is we will change. We went from being paid for as many costs as we could actually ring up in the 1970s to dealing with fixed budgets. And now we're moving to being paid to actually do less and to keep people healthy. And so the challenge in healthcare leadership is to educate the community and our staff about where healthcare needs to go. And that can very much sync up with the ideals of creating a very different approach to healthcare delivery. It all comes down to communication. It all comes down to alignment. And if you can align your leaders and your staff in a common vision, you can have a successful business or a successful healthcare system. If you can win the hearts and minds of your staff and your community and get them around a common vision, you can do wonderful things.
Well, I think that is a perfect place to end. So thank you so much for your time and sharing your vision and your ideas and what's worked for you as a healthcare system leader. And we wish you all the best in your retirement and your continued pursuit of long distance running. And let's go. And let's go Red Sox, right?
Thank you.
Yeah.
And happy hospital week to all of our 3,000 plus staff across Central Maine and across the state of Maine. Thank you for all that you do on behalf of our communities.
Well, thank you again, Jeff. And thank you everyone for being with us this afternoon. We have a beautiful weekend on tap, so please take advantage of it and get outside. When you leave today, you'll get an exit survey. We're thinking about Like a Boss in the fall and actually doing events in person, maybe combination in person and on Zoom. So we love your feedback on that. So we wish you all the best. And thanks again for being with us today.